Hi, I'm Dr. Tom Klein, back with questions asked and questions answered. Some questions have been sent to me, and this week specifically there's the focus on heart disease. So let me introduce this difficult subject. The question was, heart disease is the #1 killer of women. Why are women more susceptible than men? So one of the questions has been, is there something unique about women that makes them vulnerable to heart disease? Part of that answer to the question is yes, there is. That uniqueness isn't so much that they're more likely to get damage, only that they're less likely to notice it. Heart disease in women is slightly unique. Men get chest pains, pain that radiates up into the neck and down the arm with fatigue and shortness of breath, breaking into sweat, and man, they're running for the ambulance to come and get them. So men traditionally find themselves in the emergency room easier than women. Women have slightly atypical, sometimes they have no chest pains at all. Men can have that too, but more typically in women, sharp pain, stabbing pains, pains in the back, fatigue, some shortness of breath. But the traditional symptoms of heart attacks and strokes in women, specifically heart attacks in women, are less than men. And consequently, they don't show up as quickly to the emergency room. 47% of the people who die of heart disease die on the outskirts of the emergency room, close to the emergency room, on the way to the emergency room. And so women typically ignore or don't know and consequently show up relatively late and sometimes show up too late. So if we go back to women and we go back to men and heart disease, anything that increases the disease of the blood vessels will cause heart attacks. And women over the last 50 years have unfortunately fallen after the men and have started to do the same thing. So the rise in women and the increase in women is thought to be related to the risks that are taken. So it's not that women in particular are vulnerable to it. It's that the symptoms are often ignored and they are slightly atypical. And secondly, they are not going to the emergency room as quickly as they probably should. And that's part of the reasons why their deaths have risen. Now, if we balance this out, when we talk about heart disease being the #1 killer, it makes it sound that if we get rid of heart disease, that we have nothing to fear. Well, truth will be known, the #2 killer is cancer. And so we have this double thing. You can't talk about heart disease without also decreasing the risk of cancer. Well, it turns out that when you talk about cancer, you're talking about triggers for that. And some of the triggers for heart disease are also triggers for cancer. Change these things. I'm asking you to exercise. Interesting thing, people who over-exercise have an increased risk of heart attacks. People who under-exercise have an increased risk of heart attacks. People who do moderate exercise on a regular basis have a reduction in the risk. Lastly, as far as heart disease is concerned, I repeat what we said earlier, risk reduction. Please eat your fruits and vegetables. Please exercise. If you smoke, please stop. As far as fat in your diet, there's been much debate recently about whether fat is positive and fat is negative, and so I'll leave that for you to communicate with your physician. An excess amount of fat is not a good thing, but no fat at all is also not a good thing. Again, questions asked, questions answered. Please feel free to send your questions in. We welcome them and we'll be glad to respond to them. Thank you.